Hello, my name is Ryan and I will be doing an HEENT assessment today. Before going into my room, I'm going to make sure that my patient has privacy. I would have done hand hygiene foam before I came in and make sure I had all the appropriate equipment, which I do. It was already in the room. Upon arrival, I would greet my patient. In doing so, I can get a feel for her mood, if she has any trouble hearing, her speech. I can go ahead and get a good look at her hygiene, skin color, and in doing so, I can get a good feel for her nutritional state, if she's malnourished, anything like that. And I can also look at her clothes and see if she is dressed appropriately for the season we're in. You know, she's walking in shorts and it's 20 degrees outside, might cause note. Next is what I'm going to do, is I'm going to put on some gloves. And I'm going to go ahead and take a look at her head and face. So I'm going to start at the top of the head, and I'm going to ask her, have you had any dryness, dry skin, anything with your scalp, any recent hair loss?
Nope.
No? Okay. As I'm feeling around her head, I can feel for any bumps, any abnormal bone growths. And as I move down, I can go ahead and assess the temporal artery. Okay. And then in doing that, I can start pressing on the sinuses. Do you feel any discomfort with that?
No.
How about this?
No.
No? Any here?
No.
And while I'm here, I'm going to go ahead and assess the TMJ. Go ahead and open your jaw for me and close. Open again. Good. And while I'm doing all this, I can look at facial symmetry. Cole, can you go ahead and smile for me? Very good. Okay. Okay. And after we've assessed everything, a lot of times you can get a feel for if they're oriented, but it's always good to ask. Nicole, can you tell me your full name and your date of birth?
Nicole Brown, 2692.
Very good. And Nicole, what brings you into the clinic today?
I'm just here for my annual physical.
Good,
No
good.
complaints.
Can you tell me what month it is and what year it is?
It is September of 2015.
Good deal. And what city are we in?
Springfield.
Very good. Okay, next we're going to move on to the eyes. A lot of things, different things you can do to the eyes. The first thing I'm going to do is look at the overall structure. If she's opening her eyelids symmetrically, I'm looking at the color of the sclera, conjunctiva. I'm looking at pupils, seeing if they're round and they're not irregular, if she's got any redness, tearing, crusting, anything like that. Next thing we're going to do is we're going to do the cover test. So Nicole, can you cover one eye for me? Good. And just tell me how many fingers you see.
3, 2, 1.
Good. Can you go ahead and cover the other eye? We're going to do the same thing.
2, 1, 3, 0.
Yes, very good.
Trick question.
Okay, I want you to look straight ahead and just tell me when you see my fingers wiggling.
No.
Good.
No.
Good. In doing that, you can test her peripheral gaze. Another thing you can do too is the Snellen chart. Have them stand 20 feet away, look straight ahead, have them cover one eye, and then they would read lines. And in doing so, you can kind of test if they're far-sighted, nearsighted, or if they're perfect 20/20. Next, what we're going to do is we're going to check pupillary reflex. I apologize, this is a bright light. Just look straight ahead. Good. All right, you're probably going to be a little spotty, but the next thing we're going to do is I'm going to test your cardinal gaze. Just look straight at here. Can you see it? Okay, just follow with your eyes. Good. 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 Doing that, you're looking at the extraocular movement. Also, what we can do is we're going to look, it's another bright light. Oh, and I shined it in mine. It's the, I think it's called the red eye test. Basically, you're just looking at the health of the retina. Just look straight ahead for me. Good. All right, gonna put that away. Next thing we're going to do is we're going to look at the ears. You're going to look at the overall structure, and you're going to look for symmetry, making sure that they're both even, that one's not higher than the other, or any deformities, anything like that. We're going to go ahead, put on a different head. And before you even get a good look, you can go ahead and just look at the outside of the ear. Make sure that there's no drainage, anything like that. Go ahead and look inside, and you're looking at the ear canal and the tympanic membrane. Gonna do the same thing on this side. So what we're gonna do is the whisper test. I'm gonna stand on either side of you, and I'm gonna whisper a number, and you just tell me when you can hear it, okay?
7.
Very good.
5.
Very good. All right. Next, we're going to look at the nose. You're going to make sure and look at the overall structure. Make sure it's not deviated to one side. You can check and see if there's any drainage. I'm going to use a different tip since this one was just in her ear. Okay. Sorry, I know this might feel uncomfortable. And in doing that, you're looking at the mucosa. Whoop, I'm not even in there. Here we go. Sorry. Does it tickle?
A little.
Okay. Basically, is what you're going to be looking for is just if they have any dryness, redness, looking at the overall mucosa, if they have any septal deviations. I'm trying to do it so I don't poke you right in the nose. Does it tickle? My apologies. Also, in looking at it too, you can see if there's any drainage or anything like that. Okay. Next, we're going to look at the mouth. And Nicole, can you go ahead and open real wide for me? Good. You're going to be looking at the tonsils, uvula, oral mucosa, teeth. Oh, sorry. Keep saying ah for me. Good. And she's also sticking out her tongue. Can you stick your tongue again? Move it side to side. Very good. Okay. Last thing we're going to do, you got to be careful with this one. Kind of get a feel for your patient, so you don't lose a finger. But you can test the hard and soft palate. Actually, let me go ahead and put on a different glove since I've been touching around on your head. Just open your mouth for me. You can take this peel back and go back a little further, and you can feel kind of the ridge where it turns on the soft palate. You can kind of go along the cheeks. Hey now. Okay.
I think I'm almost falling.
Oh, did it? We'll put on a different glove. Okay. So next thing we're going to do is we're going to look at the neck. First thing you can do is just look and make sure that the trachea is midline, it's not deviated off to one side, anything like that. Next thing you can do is you're wanting to palpate. Ask if she's got any tenderness. You're looking at the lymph nodes. You got some in the back of your neck. Any tenderness with that? No? Anything? Any tenderness? Okay. You're also looking at it, making sure they don't have any jugular vein distension. And then next thing you can do is check carotid pulse. Do it one at a time. You don't want to do both sides. You're going to cut off blood flow to the brain. Okay, she's got a good pulse on this side. Good. Okay, next I'm going to test your range of motion. Can you go to the side for me? To the other side? Good. Back and forward. Did you have any pain or discomfort with anything like that? Okay. Go ahead and push against my hand. Push. Good. This one's a little harder. Push. And push. Okay, good. And that includes our assessment. And next time to get everything documented.